are now going to quickly discuss what to do if you get a confused NHS number. So, Ellie, if you could kindly explain what a confusion is and what that would mean for the patient, please.
So confusion is when two or more patients are using or sharing an NHS number. It could be that when the patient has been registered with the incorrect NHS number, or when the patient's information has been added to a different patient's demographic record. As this may impact the patient by sending or having incorrect medical records, patients unknowingly deduct their GP practice and may miss out on their screening programs, and potentially clinical risk to screening programs in incorrect medical records being provided. So they're quite serious confusions, need to be resolved as quickly as possible.
Brilliant, thanks, Ellie. So on that then, so how are confusions resolved?
So PCSE will ensure that all the correct information to confirm the confusion. Like a duplicate, this may mean that we'll reach out to other GP practices or third parties for this information. So you need to log it with us on the online form. And once we acquire all that information, we will log a ticket with MBO to correct the spine, removing any incorrect information and putting demographic data in the correct state. PCSE will then contact the impacted GP practice with the numbers for the corresponding patients. This may concern more than one practice, so you may receive one email and then later another practice receive another one regarding their patient. And we support each of you in aligning your own clinical systems and with ensuring it's aligned with spine. PCSE may also contact you if they have identified or been made aware of a potential confusion, just like duplicates. Please ensure you respond to these requests, again, like duplicates, in a timely manner. As mentioned, there is an increased clinical risk for your patient if a confusion is identified.
Thanks, Elliot. And I suppose the question again, how long does it take?
So, yes, similar to duplicates, the process length does vary and it can be quite lengthy for confusions depending on the complexity. So the end-to-end process confusion resolution at the moment is about 10 weeks, and it is dependent on timely responses again. MBO is our main dependent on that. If you're logged a new online form for a confusion, PCSE will contact you via email within 15 working days. We're currently working at 7 working days, so we sometimes do contact you sooner. If it goes over that 15 days, please contact us further to ensure you do receive that first response. We'll then make contact, just like duplicates, all the way through the process at different stages. And you can ask additional updates via the second contact form at any point. Again, we're dependent, as I've said previous times, on third parties, and we have no control over their timescales. So if it is with MBO, you escalating again and again won't lead us to be able to change that. It's just that with them.
So again, is there anything that the practice can do to avoid any common issues?
So again, as previously mentioned, PCSE may reject potential registrations. You need to make sure that your NHS email account is up to date and your main contact is responding to those rejections. We also require a lot of information, making sure that your registrations contains all of that detail that we need. Middle names, the birthplaces, the date of entry will just help us to avoid those confusions if we see them, and it helps us to identify them. And all the information that you obtain shouldn't be guessed or inputted from previous data. We need it from the patient directly to ensure that it is correct and you haven't identified the wrong patient and we don't select the wrong patient for you.
Yeah, sounds good. Thanks, Ellie. So basically, give us as much information as you can. That's great. Thanks, Ellie. Okay, so back with Brenda then. So we're going to have a look at some confused NHS number scenarios then. Okay, so Brenda is trying to register Connie at the practice, but she has noticed that Connie has provided an NHS number that looks like it belongs to another patient. So what could that mean for Connie? So it could mean that she's previously registered with the incorrect NHS number. Could be that she's using the same NHS number as someone else. Another patient's details could be added to Connie's record. The incorrect records could be sent to another practice. She may be deducted from the practice incorrectly. And as always, there's a potential risk to care if she's not called for screening programs and things like that. Okay, so what does Brenda need to do then? So as Ellie's already mentioned, contact PCSE using the online inquiry form. Gather as much information as you can, addresses, names, GP registration history, all that wonderful stuff. Provide as much detail as possible when submitting the online inquiry form and send it as soon as possible. And if you do get any responses from us, make sure that you are monitoring the emails and replying as soon as possible. The more information that we receive will make it easy for us to rectify for Connie and yourself. So what will PCSE do then? So we'll investigate to see who the NHS number belongs to. If we are confident we know who the NHS number relates to, we'll raise a case with the NBR. We may provide initial advice on how to register the patient, depending on the scenario. If we're not sure, we'll contact the practice for more information. And once the NBR has resolved the confusion, we'll contact the practice with additional advice. Additional advice could be things like what to do with the medical record, but again, that can differ based on different scenarios and things.